With COVID-19 shots reaching billions of people, several reports have grown more common of people getting infected with coronavirus infection in spite of being vaccinated. Why is this so? Let's watch this. So far, there are now approximately 3 to 4 billion shots of COVID 19 vaccines being given worldwide. Enough doses have been administered to fully vaccinate 25.1% of the global population, but the distribution has so far been lopsided, favoring more of the rich countries, while unvaccinated continues to be predominantly a problem in poor countries. We know that the current slate of vaccines remains highly effective at preventing cases in terms of hospitalization and severe disease. And these are all based on current data from the US, UK, and Israel. Yes, the vaccines we now have may be less effective at preventing mild cases of Delta variant of COVID-19, but the disproportionate toll that COVID is taking is actually among the under-vaccinated communities. In fact, we have dubbed the present pandemic as the pandemic of the unvaccinated. So, just as natural infection doesn't guarantee protection from reinfection with the virus, neither does immunization provides a perfect shield. So, there's no such a thing as 100% protection, 100% cure in medicine. Still, those who have immunity either from vaccination or previous infection continues to carry a fraction of the risk of those who have none. The so-called breakthrough cases among the immunized are a reminder that as long as the pandemic virus is prevalent in the world, this COVID-19 virus will remain a threat to everyone. Remember, vaccines are more effective in blocking the disease than they are in blocking infection. However, the good news is fully or partially vaccinated people has a 40% lower average viral RNA load than the unvaccinated and a 48% lower risk of fever and shorter illness with 6 days of symptoms and 2 fewer days spent of being sick. So one of the most common questions that I've got from the videos that I've presented is that why are vaccinated people testing positive for the coronavirus? The first thing that I want to assure everyone is that when you get vaccinated, and if you're going to get an RT-PCR test, it will not become positive just because of the vaccine. In other words, testing positive after vaccination indicates that you got an infection from SARS-CoV-2, the coronavirus that causes COVID-19. Now, all the vaccines provide a strong defense against severe disease. They don't protect against the infection 100%, meaning many vaccinated people are still at risk of catching the disease and catching the virus and transmitting it to other people. Now, the problem with community pandemic is that the more SARS-CoV-2 is circulating in a community due to the very high prevalence of unvaccinated individuals, then the higher the chances of getting an infection. And the more infections there is in a community, then the more chances for the SARS-CoV-2 virus to breed and mutate to a stronger variant. In some instances, those infections will break through the protective shield that vaccine induced immunity provides to cause COVID 19 symptoms. And in fact, in very rare cases, the illness may be life threatening. Again, as we said, most of our vaccines are only 80 to 90% protective against death. Likewise, one of the major reasons why I always tell my patients to vaccinate is that it can significantly lower the chances of getting the so called long COVID syndrome. Now, it is a syndrome where the patient will continue to manifest symptoms of COVID 19 like lasting fatigue, breathlessness, and other symptoms seen in approximately 1 in 10 COVID 19 survivors due to unvaccination. At all this list of symptoms associated with long COVID syndrome, it may even last from 6 months to a year after your COVID 19 infection. So, why do breakthrough infections occur among the vaccinated individuals? It actually comes to the following factors. One, we all know that the pandemic virus continues to mutate into worrisome variants that are both more infectious and better adept at evading immunity provided by either inoculation or past COVID 19 infection. We all know that current data indicate that most COVID vaccines authorized for use offer protection against severe illness caused by most common variants with some inoculations. We also have to remember that even the most effective vaccine delivered ideally does not guarantee immunity. Some individuals may actually not mount a robust response to the vaccine, meaning they fail to generate sufficient levels of the virus blocking antibodies and the T cells that hunt down and kill the virus infected cells. Specifically, of special concern are the older people and the immunocompromised. You may have heard of some of your friends who are elderly with multiple medical problems who were already vaccinated and yet succumbed to SARS CoV 2 infection and developed severe disease and died not because of the failure of the vaccine, but most likely because the individuals failed to mount enough immune response due to age and due to major comorbidities. Even in those with good immunity, we still don't know how long will the vaccine protection last. It is likely to wane over time. We are still looking at studies to see up to how many years will this protection from COVID 19 vaccine protect us against the infection. And these breakthrough infections are not common to a specific vaccine. We may have heard of hypes regarding Sinovac among Indonesian doctors, but we also have to remember that in Israel, which by early 21 they had given more COVID vaccines per capita than anywhere in the world, they recorded 400 hospitalizations among fully vaccinated patients by late April. And of this, 234 suffered severe COVID and 90 cases were fatal. In other words, it is not due to a certain vaccine that breakthrough infections occur. We have to remember the environment, the healthcare worker situation in a specific country before we say that there is vaccine failure in protecting these people from getting COVID 19 infection. In fact, a careful review of almost half of hospitalized vaccinated people recently published in Israel found that the risk of developing a severe illness even after vaccination with an mRNA Pfizer vaccine was magnified by pre-existing conditions such as high blood pressure, diabetes, and heart failure, as well as medical conditions that really weakened the immune response. So I would like to present to you a Twitter of a certain doctor in the Philippines showing actual cases of breakthrough infections. Very reassuring photos of patients that were infected with COVID 19, and whether the patient was on Sinovac or Pfizer or AstraZeneca, they were at least protected against getting severe disease. She then reminded the public to get whatever vaccine is available to be protected against COVID 19 and hospitalization. Again, reminded all of us that yes, we can still get COVID 19 even if you're fully vaccinated, whatever vaccines you got. But if you're going to get infected, most are going to be mild. You will also be more protected, and you have significantly reduced the possibility of becoming severe or placed in the ICU. All of them have served its purpose, meaning to prevent severe infection. That instead of boasting you are Team Pfizer versus Team Sinovac, let our mindset be that we need to be vaccinated, whichever is available vaccine on your vaccination day. Get protected before another surge comes up, Delta variant or not. This is still one of the most effective protection we can ever have. One of the common questions I always get is once an infected, vaccinated person, can he or she spread the virus? Still, COVID vaccines have been shown to shorten the duration and lower the amount of infectious virus particles or viral load in the upper airways of vaccinated people, thereby reducing the likelihood that they will transmit an infection to others. So if you like my video, please click like, subscribe, and click on the notification bell so that you will be updated for new videos to come. So again, I'm Dr. Jerry Tan. See you again soon.